Okay, I'm absolutely on one today. You've probably seen I have a lot of videos in the same shirt. Yeah, I'm on a rant mood, so please listen to them all if you can, if you find me entertaining. Let's talk about the health insurance industry. Fuck them. In a nutshell, TLDR, fuck them. But now we'll get into why. So, I go see my doctor once a year. I have a condition that I need to get my blood taken once a year to see if the medication is still at the right dose. And even before that, did you know, especially men, did you know that if you are a female of reproductive age in this country, you have to go make a doctor's appointment and go to your doctor at least once a year, sit in front of her and say, "Hi, yeah, everything's like completely fine. I don't have any problems. I just need you to refill my birth control prescription because I'm still taking it." You literally have to do that. And either your insurance will pay the $300 or you will for that appointment. It's so crazy. I hate it so much. We should just be able to get that. We shouldn't even need a prescription. It should be over the counter. But if I want to go the prescription route, it should just be I'm prescribed it one time, and then maybe we can revisit that when I'm 45 and getting near menopause. But why do I have to go sit in front of my doctor every year? Are you just confirming that I'm still alive so you're not sending a prescription into the void that no one's going to fill? That's crazy, dude. That's crazy. The next thing is, every time I go to the doctor, it's like there's this crazy stigma to people who are not insured. And I've done the math on it. I had a video where I talked about it, but basically my out-of-pocket cost, uninsured, is roughly the same as my out-of-pocket cost would be with insurance, just to cover the premiums, and that's it. That's crazy. That's not even talking about deductibles and copays and stuff. So tell me why I would have insurance, because it doesn't make sense. You can watch that video for the full breakdown. But yeah, so I've done the math for myself and I'm doing what makes sense to me. Why does the receptionist at the doctor's office have to say, "Oh, do you have insurance?" And then I say no. They're like, "Oh, really? Are you self-paying today? Okay." And look at me like I'm insane. That's my choice. I'm still paying. You're asking for my payment before I go see the doctor and you're getting it. What the fuck do you care who pays for it? That's crazy. I'm still giving you money. At least I'm coming here. Shouldn't you be just happy that I still care about my health even without insurance? That's wild. And then I get to the doctor part, and then the nurse has to say, "Do you still have insurance? We don't see any on file." No, I don't. That was not a mistake. And that would be fine if that's all they asked. But then it's like they give you this look, man, "Oh, you're one of those. You don't have insurance. You're one of those people." I don't know what those people normally do, but I'm not doing it. I pay for my bill. What? And then the doctor comes in and it's the same thing. "Oh, I see it says you don't have insurance. Is that true? Does your employer not offer insurance?" Well, I mean, yeah, Domino's does offer us insurance. They just put it on a piece of paper and say, "Here's what they're offering on the market. It's $300 a month. Are you interested in that? I know you only make fucking $800 per paycheck. Would you like to do this?" Probably not. But yeah, like, and then they're shocked about that. And I'm like, you work in a hospital. Of course you have good health insurance. That's not the case for everybody. Maybe open your eyes. You see all kinds of people all day. If you have this question often enough, do some research and learn about it and stop having such this stigma around people who are uninsured. At least I'm still taking care of my health and coming here sometimes. And then, when I go to the pharmacy, it's the same thing. The pharmacist says, "Oh, so, do you want to pay with insurance today? I don't see any on file." And I say, "No." And they're like, "Oh, okay. I guess we can just use the discount. Are you planning on getting insurance?" And it's like, why does everyone want me to get insurance? Why do you care so much? I'm giving you money. I'm taking care of my health. What does it matter to you? What does it matter to them? What is the incentive? Do you, the pharmacist worker, do you, the nurse, do you, the receptionist at the hospital, and do you, the doctor, get a personal cut from my insurance plan when I sign up because you asked me while rolling your eyes, oh, so you still don't have insurance? Like, do you make money from doing that when I sign up finally because of this weird peer pressure that's going on? By the way, I'm not going to sign up, so don't keep doing it, even if the answer is yes. But like, what's up with that? That's so weird. It's very the same energy that you get from middle-aged people that have kids and they see you and your boyfriend or whatever out and they say, oh, still no kids? Like, no, bitch, I don't want kids. They're expensive and time consuming, and I'm not interested. And it's like, oh, well, because I do it, you need to do it. Because I suffered, you need to suffer too. Like, not saying that all kids are suffering, but like, health insurance kind of is. Like, unless you have a real reason, like, unless you've done the actual math and determined that you need it based on your financial situation and your condition, like, why are you subjecting yourself to unnecessary suffering? Like, don't come at me with, oh, you still don't have insurance? Like it's some kind of moral shortcoming of myself to not have insurance. Like, mind your own business. I don't have insurance because it doesn't make sense. And when I did have it, it was very not helpful. Like, I've had claims denied. I still had to pay everything. I went to the ER. I was stuck with the entire fucking bill. You think you have insurance to cover an emergency? You better read your plan. Like, they didn't pay for shit. I called them up and I said, excuse me, you're not going to help with any of this? And they said, oh, we'll throw you a bone. We covered $200. $200 out of 6,000? That's not very helpful. Like, fuck you. So, if you do have it, make sure you read your plan and make sure you do some prep work before you go get anything done or go anywhere because they like to deny the claims, dude. Like, you're paying the premium. That doesn't mean anything. That just means you're giving them free money. Like, make sure they'll actually cover your stuff when you need it. The worst thing would be if you have health insurance thinking you're covered in some kind of emergency or if you develop a condition and then God forbid that thing happens and then it doesn't help you out. So what, you've just been throwing $300 in the trash every month for some kind of security that isn't even real? What a waste of money. You could have been saving that. It could have been in a savings account specifically set aside for your health and you could have covered whatever it is. But no, now you're just throwing it into the trash. So, think about it. And tell me what that stigma is about.